How's it going, guys? Past level question for Gastro step 1. Before you start, please subscribe to my channel. Really appreciate it. Give it a like. Really appreciate it. Find me on Instagram, threads, Mehlmanmedical, Mehlman_medical. Links down below for my Telegram. Links to Telegram, give me channel down below. Let's start the clip. 44-year-old woman, loose stools, and orthostatic hypotension for 1 year. She has 30-year history of type 1 diabetes mellitus. Question wants to know which of the following is most likely explanation for presentation. Let's just hop to the answer choice here. Choice A, exudation, wrong fucking answer. I've never seen USMLE care about this. I've seen it as a wrong answer choice in this type of question. You can know exudative diarrhea means blood and or mucus production. So you could have infectious, okay, the gram-negative rods in particular, EHEC, Shigella, Salmonella, Campylobacter, Yersinia, all right, as well as inflammatory bowel disease. It can be other things like diverticulitis, ischemic colitis, radiation colitis, nonsense for USMLE, okay? I would just pretty much know IBD, and infectious causes of stool where you get blood in the stool, such as the gram-negative rods, as I mentioned. In this case, wrong fucking answer. Choice B, generalized malabsorption, wrong fucking answer. So I would probably, if you were to ask me what would this apply to most strongly, I'd probably say celiac disease, okay? So they love flattening of the intestinal villi. They'll give you an easy vignette of celiac, and then the answer is just enterocytes. So they'll ask you which cell is fucked up. Enterocytes the answer, which is a small bowel cell, okay? Flattening of the intestinal villi. And there's two very high points for celiac disease, which is, apart from, we go on a long discussion, anti-endomysial antibodies, anti-gliadin, anti-gluten, anti-tissue transglutaminase IgA, but two very high points you need to know are, one, you can get iron deficiency anemia. So this is how you differentiate it from lactose intolerance, i.e. lactase deficiency, where if you get a big fucking paragraph and it's pretty vague and you're not sure what the diagnosis is as far as lactase deficiency or celiac, but they tell you MCV is low, hematocrit's low, that's iron deficiency anemia you get due to impaired iron absorption in the duodenum due to flattening of the intestinal villi. Exceedingly high yield detail for celiac disease. I harp on that in my GI PDF, and also I've made prior clips on that. Second point you need to know is that the D-xylulose test is going to be abnormal. D-xylulose, a monosaccharide that doesn't require any enzymes for absorption. All you need is an intact intestinal lining. So in celiac, where you have flattening of the villi, you're not going to be able to absorb D-xylulose well. In turn, you won't be able to pick it up in the blood, okay? So in contrast, where we have exocrine pancreas insufficiency, chronic pancreatitis, cystic fibrosis, where we have, and also lactose intolerance, we have an intact intestinal lining, so D-xylulose is absorbed just fine, okay? Wrong fucking answer. Choice C, motility disorder, correct answer. So this is going to be diabetic neuropathy to the GI tract, okay? It can present in numerous ways. It can be gastroparesis that can present as a GERD-like presentation in a patient with long-standing diabetes. It can be diarrhea, it can be constipation. So here we have diarrhea and we have orthostatic hypotension, which we could argue is just from maybe hypovolemic status, and that's why we have the orthostasis. But could also be dysautonomia, where we have neuropathy actually to the nerves innervating the blood vessels as well, making it more difficult to constrict upon standing. So diabetes, they want you to know motility disorder as the answer. You need to know a little bit of anatomy. It's very annoying and nitpicky, but you need, and it's a pass-fail step 1, of course, but the minimum anatomy I want you to know is that the pelvic splanchnic nerves are parasympathetic and they're pro-peristalsis. If we have neuropathy of those, we get severe constipation, all right? The hypogastric nerves are sympathetic and they're quote-unquote anti-peristalsis. If we have neuropathy of those, you'll have diarrhea. So they'll give you the same fucking question here. Say patient with long-standing diabetes has loose stools. Which nerve is fucked up? And you're like, shit, I hate this anatomy stuff. But that's just going to be hypogastric because we'd have unopposed parasympathetic, unopposed pelvic splanchnic. So let's just whip to the other answer choice here. Choice D, osmosis, wrong fucking answer. This would refer to lactose intolerance, okay, where you have lactose, a disaccharide within the small bowel lumen, and you have decreased disaccharidase at the brush border, so you can't break it down into a glucose and galactose molecule for absorption. So the osmotic pull of having increased solutes there from the lactose could cause an osmotic diarrhea. In this case, wrong fucking answer. Choice E, secretion, wrong fucking answer. So secretory diarrhea could be Campylobacter, sorry, not Campylobacter, I said that was exudated before. Clostridium perfringens. Okay, so there's an offline NVMe question somewhere where they give you gas gangrene caused by Clostridium perfringens, and they say the most likely causal organism can also cause what? And the answer is secretory diarrhea, okay? This could also apply to ETEC for traveler's diarrhea, where we talk about the heat labile toxin increasing CAMP, the heat stable toxin increasing CGMP. They're not going to get technical as far as the word secretory attached to it. I'm just letting you know that where you've got the CAMP mechanism there, the 80 puribosylation, that could lead to increased chloride secretion. Okay, so Clostridium perfringens and traveler's diarrhea, you could know as secretory diarrhea. Wrong fucking answer. You know the deal. I'm just to make more content. If you like my stuff, subscribe my channel. Appreciate your time. That's it.